We think about science as being something where every step is co-created with partners in the community. We are dedicated to and actively working to create models of public health where that partnership is deeply baked in. We've applied that model over and over, locally here in New Haven, or through programs like new things that we're doing, working with some grassroots organizers for Make America Healthy Again in rural Ohio.
I use economics to look at the issues that American families are facing day to day. The U.S. healthcare system is putting immense financial pressure on families across the country. It's making it harder for them to live lives of dignity and purpose. The goal of my work is to say, how do we make healthcare more affordable? How do we make it easier to lower healthcare costs so families can live the American dream? One of the things I was hearing a lot, and it was getting reported a lot in the press, was this phenomenon of surprise medical bills. So December 2020, President Trump signed the No Surprises Act, and a lot of that law is built off of some of the scholarship we did in 2015, 2016. Work that I think is going to prevent thousands of families from going bankrupt.
I couldn't imagine doing work in public health without hearing the voices of people that are every day living in these communities. One of the things that I noticed in the AI movement, specifically as it's being involved in public health, is that we have the power to use AI to create these predictive algorithms to be able to inform interventions and so forth. One of the things that we're doing for the next couple of years in my lab is training citizen scientists, so training youth to learn about machine learning, to learn about AI, and having them be involved in the co-creation of these algorithms.
My research is specifically focused on understanding the ecological and evolutionary drivers of virus transmission. And my lab specifically focuses on viruses that are transmitted by ticks and mosquitoes. I think many people have heard of Lyme disease, but other pathogens are rising as well. And so one example is Powassan virus, mostly in the Northeast and upper Midwest of the United States. And especially that increase in cases really is concerning. We don't have any specific treatments or vaccines. We collaborate very closely with many academic and state public health labs. This is active research that we're working on to really understand those barriers and drivers to transmission that might mean we can have long-lasting impact on prevention and control.
From partnerships with the School of Engineering to partnerships with the Department of Economics and the Tobin Center to inform policy on both a local and national level. Those types of partnerships are only possible at a place like Yale that comes from a willingness to engage with society far beyond the walls of our institution and to make sure that folks are getting what they need in order to improve their own and their family's health. That ripple effect is tremendous, and that gives me great hope.